Good morning everyone. This is Vafa Fathima from 103B. Today I would like to talk about a common but often underestimated condition, laryngitis. Laryngitis is the inflammation of the larynx, commonly known as voice box. It occurs when the vocal cord becomes irritated or swollen, which affect the ability to speak properly. The most noticeable symptom is hoarseness or even complete loss of voice. Other symptoms may include a dry throat, sore throat, cough, and thickening of the sensation in the throat. Laryngitis can be acute or chronic. Acute laryngitis usually result from the viral infections like common cold, flu, tends to resolve within a week. Chronic laryngitis, however, may last longer and is often caused by the factors like smoking, alcohol use, acid reflux, or overuse of the voice. Treatment depends on the cause. For viral laryngitis and rest and the hydration are the key factors for the treatment of the to avoid laryngitis. It's important to avoid whispering or straining the voice further. In some cases, medications like antibiotics or the proton pump inhibition may be needed, especially if bacterial infection or reflux is involved. Preventive measures include avoid smoking, staying hydrated, and giving your voice adequate rest. If laryngitis persists for more than 2 weeks, it's important to see the doctor as it could signal more serious underlying condition. And we have talked now we have let's we have talked about the how laryngitis happens. Laryngitis occurs when the larynx or voice box become inflamed or irritated. This inflammation mainly affect the vocal cord, which are the two bands of the muscles that vibrate to produce sounds. When they become swollen, they can't vibrate normally, leading to the hoarseness and loss of the voice. Causes of the laryngitis is the first one is the viral infection, most common cause, often linked to the cold or flu. And the second one is overuse of a voice, yelling, signaling loudly, speaking for long period can strain vocal cords. It has been affected for the professors or teachers or singers, etc. And the third one is irritants. Smoking, alcohols, dust or pollutions can irritate the larynx. Acid reflux, the acid produced by in the stomach rising up into the throat can damage the vocal cords. And fifth one is the bacterial infection, less common but possible. It have possible to affect the larynx. Allergies or sinus problems is the sixth one. And now we can discuss how we can avoid this disease. Protect your voice, avoiding shouting, screaming, or talking loudly for long period. Take voice breaks if you use your voice a lot. Example for teachers and singers. And use of microphone in large settings instead of straining your voice. And second one, stay hydrated. Drink plenty of water to keep the throat and vocal cords moist. Avoid caffeine and alcohol, which can dry out your throat. Avoid irritants. Don't smoke and stay away from the second-hand smoke. Avoid alcohols. Avoid exposure to the dust, smoke, strong fumes, and chemical vapors. Prevent infection is the fourth one. Wash your hands frequently to avoid the catching cold or flu viruses, and avoid close contact with sick individuals. Strengthen your immune system with proper sleep, nutrition, and exercise. Fifth one, manage acid reflux. As we all know, the HCl from the stomach which rises to the our throat, which causes the laryngitis. To avoid this laryngitis, based on the acid reflux, eat smaller meals, avoid spicy or fatty foods, and don't lie down right after the eating. And raise the head or your of your bed if you have nighttime reflex. Use humidifier. Dry air can irritate your throat, especially in winter. A humidifier adds moisture to the air and helps keep your throat comfortable. In conclusion, while laryngitis is usually not serious, proper care and prevention are essential for the protecting our vocal health. Thank you for listening.